Hello and welcome to Los Angeles. I'm Jennifer H Caldwell, your host for Brighter, and this is the second part of my interview with Dr. Helen Yaffe, which is basically a presentation all about Cubas medicine for COVID-19, interferon alpha B. Dr. Yaffe will talk about how the medicine works, how it's part of Cuba's larger biotech sector, and how that biotech sector interacts with Cuba's public health system and public education system, which is far different than it does here, and very interesting. So, without further ado, let's get to it.
Okay. So I'm going to talk about the development of Cuban medical science and how it has benefited humanity, not just Cubans. And then I'll say a little bit, if you would like, at the end about how the Cubans are responding to the current COVID-19 pandemic.
Mm-hmm.
Okay. So to really appreciate what's so exceptional about the Cuban biotech sector, we have to start with where biotechnology started, because really we need to see how it developed in the United States, which was the first place it developed, and the characteristics that have shaped the capitalist biotech sector. So the biotech sector was launched in the United States with venture capital. This is high-risk speculative capital, which has really been harnessed with the creation of the NASDAQ stock exchange in 1971. The first biotech firm was established in 1976, and it wasn't until 1980 that the second biotech firm was established, and both of those were in the United States. So biotechnology firms and sector didn't really take off until the 1990s in Europe, subsequently Japan, Singapore, and China. Now, there's some very interesting characteristics about the biotech sector, which is to do with the process, how long it takes to research and produce drugs, and internationally did not achieve profit from product sales. So from the actual medical products that are produced, it didn't receive a profit globally until 2009. So there is a dichotomy there. How do we explain the fact that billions of dollars of venture capital and money from big pharma companies poured into the sector? And the reason is due to the development of financial mechanisms which enable stock market investors to profit through trading biopharma stock, even when there is no commercial product. In other words, there is no medicine that has been produced to treat patients. Biotech products can take easily up to 20 years to commercialize, and by 2002, only 100 biotech-related drugs had reached the market in 30 years. By 2011, most biotech firms doing what are called initial public offerings, so doing exchanges on the stock exchange, IPOs, are productless. So there's this very fascinating dichotomy about an industry that has a lot of speculative capital and actually produces very little of medical value. Okay, now because I'm talking about speculation and profit seeking, this doesn't mean that this all goes on in the private sphere and has nothing to do with the public sphere. In fact, there's a great deal of public money which has helped to foster and maintain this private profit making through biotechnology. The government funds basic science through National Institutes of Health, millions every year, tens of millions. It subsidizes the training of medical researchers, and it decides what drugs or therapies to include in healthcare programs. Those decisions obviously affect and influence the decisions of the biopharma companies. The FDA regulates manufacture and commercialization conditions. It can decide which products from which companies to commercial or to allow the commercialization of. And there's other forms of legislative support for capitalist biopharma industry. Very important law in 1980 was passed, the Bayh-Dole Act, which gave private property rights for new knowledge that was produced from federally funded research. So, for example, a university in receipt of public money could make a discovery and then patent it so that it will belong to a private interest. And in the same year, in 1980, the Supreme Court ruled that genetically engineered life forms are patentable. So as we can see, the question of how the biotech industry functions is not just one of whether it's the private sector or public money going into it. It's really a question of who controls production and distribution and in whose interest. So,
yes, I just want to interject really quickly.
sure.
That's so fascinating to me, how basically the money's going from the public to the private interests.
But we see that in so many forms. If you think about the bailout of the banks after the crash of 2008, that was another huge example of how public money was bailing out private interests, in this case, private financial institutions. And we can see that today with the emergency packages that have been given.
Yes.
Huge big companies, who for years have paid very little or no tax, are now being bailed out by the government, while individuals who depend on paychecks that they receive week to week are now, suffering from hunger, and this is in the wealthiest countries in the world. So, moving on to the curious case of Cuba. Cuba set up, the government set up, very much driven by Fidel Castro, we have to say, and his vision. They set up something called the Biological Front in 1981. This was only 5 years after the establishment of the world's first biotech company, Genentech, and only 1 year after the world's second. So very early on, the Cubans were there. It's the first time in Cuba's economic history that it's been involved in an emerging industrial sector. And this emerged completely independently of the Soviet bloc and of the corporate capitalist model. The sector had, through the Biological Front, $1 billion channeled into it during the 1980s, which saw the creation of something called the Scientific Pole. This was a conglomeration in Western Havana of science and research institutes, including biotech institutes, and that process continued into the early 1990s. So even at that point, when the Soviet bloc collapsed, those institutes, some of them only had the very foundations of the laboratories or the buildings in place when the Soviet bloc collapsed, and the government, very much led by the decision of Fidel Castro, said, although we are suffering from a major economic crisis, we are going to prioritize biotechnology as one of 3 sectors where we will really invest resources. So the biotechnology actually took off in Cuba during their severe economic crisis, which is a fascinating fact. It was founded entirely with state investment, no foreign investment. It's entirely state-owned. Profit is not sought domestically because the biotech industry is producing products for the public health system. And the way it operates is based on cooperation, not competition between institutes. So the heads of the institutes sit down regularly also with members of the government, and they discuss the projects they're working on, and they borrow each other's technologies. And there's some very good examples of how that has helped to solve big medical problems and produce innovative products. So the sector, as I said, is totally integrated into the state-funded public health system and, of course, the state education system, which, with having so many educators and having such extensive access to education at all levels for free and universally, means that the Cubans have the critical mass of scientists that they need to develop this industry. And perhaps the most important point is that all of this is driven by public health demand. So within these institutions, multidisciplinary teams take projects through the whole process, from conception to commercialization. Decisions are all made in-house. They don't depend on the decisions of speculators or foreign investors and so on. And this has given the Cubans the benefit of a fast track from research and innovation to trials and application. And two very good examples of this are the 1981 development of interferons, which were used to arrest a deadly outbreak of dengue fever. And I'm going to go on and talk about that more. And the meningitis B vaccine, which Cuba developed in response to an outbreak, a severe outbreak of meningitis B, and was the first vaccine in the world for meningitis B. Okay, so now I'll explain the interferon story. This has come into the spotlight recently because there is a Cuban drug based on interferons, which is currently being used to combat COVID-19, to treat patients suffering from COVID-19. So if you can see in this picture, this is Fidel Castro. He is meeting with US oncologist, Dr. Randolph Lee Clark, who visited Cuba just at the tail end of the Carter administration's foreign relations with Cuba. And he convinced Fidel Castro that the positive future of medical science was based on the development of something called interferons. Now, interferons are a natural product produced, a natural molecule produced by the body. They're released by cells in response to infections. It's a form of natural defense against pathogens. And as a consequence of this conversation, Randolph Lee Clark offered to take one Cuban medical scientist to his laboratory in the United States, and Fidel Castro persuaded him to take two. So they went and worked for just a week or so with Dr. Clark, working on interferons, and subsequently he put them in touch with a man called Kari Cantel, who was working in Finland, who was the first person to have been able to separate the interferons from the human substance. And he had this procedure which he had declined to patent because he was committed to sharing discoveries in global health. So the Cubans were working with Kari Cantel, again, a very short amount of time, literally a number of days, and they returned to Cuba and they were set up in this old mansion, ex-Batista era mansion, known as House 149, and they turned that into an interferon laboratory. Now, incredibly, within 45 days, the Cubans had mastered the procedure and had their own interferon drug, and this was trialed, tested, and Kari Cantel's laboratory confirmed the quality. They tested it on themselves, and it was just in time, because just a few weeks later there was a deadly outbreak of dengue virus in Cuba. It was a very virulent strain that had never been seen before. The Cubans suspected, and said so publicly, that it had been introduced by the CIA. The State Department flatly denied that that was true, but a recent investigation by Cuban medical scientists in 2016, using bioinformatics, claimed to have evidence that, in fact, the CIA was involved in the introduction into Cuba of this deadly outbreak of dengue virus. So the Cubans, because of this incredible fast track that they have, and because there are no private interests involved, no profit seeking, they sat down between the medical scientists and the public health officials, and they decided to use the interferon to attempt to arrest the dengue fever outbreak. And it was the most extensive prevention therapy event with interferons in the world at that point. And subsequently, Dr. Luis Herrera said in 1986, "We have taken interferon as a model for the development of biotechnology in our country." He was part of the team that developed in the same year, 1986, something called interferon alpha 2B. So this was taking the interferon they had and learning how to clone it in yeast and to play around with the solutions and stabilizers and increase the efficacy and safety of the product. Interferon 2 alpha 2b was therefore produced in Cuba since 1986, and it has been used very successfully. It's shown good results on reversing viral fevers and very good results in viruses caused by hepatitis B and C, AIDS and AIDS and HIV, and with dengue. It's also been used for cancers, particularly skin cancer. So the Cubans subsequently in 2003 set up a joint venture in China, and that was called China Herbert. And one of the many products that was produced by this joint venture was the interferon alpha 2b. When the COVID-19 outbreak happened in China in January 2020, so a few months ago, the Chinese National Health Commission picked the Cuban antiviral drug, which I've been talking about, as one among a group of 30 treatments to give to patients of COVID-19. And they subsequently have moved the Cuban antiviral drug, interferon alpha 2b, it's Cuban recombinant, to the top of their list of antiviral drugs in their protocol for how to treat COVID-19 patients. The Cubans have also been using it. Now they have their own outbreak of COVID-19 on the island. Now, what some people have pointed out, well, you know, other companies and other countries also produce interferon alpha. That is true. But the product, they share a molecule, but they have different stabilizers and solutions. So the Cubans have achieved a 99% purity in extracting the interferon molecule. Their product, it is said, has high efficiency and safety. In that sense, we can say that Cuba interferon alpha 2b is a unique product. And as a consequence of the results it has shown to date for COVID-19 patients, 45 different countries have requested the product from Cuba in the current pandemic to deal with the SARS-CoV-2 virus. Now, that's not some lucky break or a coincidence. It's one of a broad range of products that have resulted from Cuban biotechnology, which really show that Cuba merits the description as being world leading for its biotechnology industry. Some of the other notable advances include, 10 gold medals from the World Intellectual Property Organization given to Cuban professionals over 26 years, the world's first meningitis B vaccine, which I already mentioned, Heprot P, which is a treatment for diabetic foot ulcers. It reduces the need for amputations by over 70%, and that is something that affects well over 400,000 people globally every year. So you can see the extent to which people around the world can benefit from that. Vaccines for hepatitis B and for dengue, tens of thousands of people around the world have already benefited from those. The world's first human vaccine with a synthetic antigen, the first therapeutic lung cancer immunotherapy, which is known as Simovax EGF. There was a documentary shown in the United States, I think last week, about this incredible discovery by the Cubans, incredible medical breakthrough, which is now being trialed in New York State by Roswell Park Cancer Institute. The Cubans also developed a ultra microanalytic system for prenatal diagnosis. They were the second in the Americas to do so after Canada and before the United States. They produce 57 million tests per year for 90 different conditions. That explains why they've had the ability to mass-produce tests for the COVID-19 disease. And 8 out of the 11 vaccines for 13 diseases which are given to Cuban children are homegrown. They are produced in Science City, which I referred to before, which is a conglomeration of around 50 institutes. And the Cubans have also been the first in the world to eliminate mother-to-child HIV transmission. So as you can see, a broad range, the incredible fruits of this Cuban biotech system with its very distinctive characteristics. And given that these products are marketed in 49 countries, some 200 inventions and products, and Cuba has partnerships with nine countries in the global south, we can see why it's possible to talk about international benefits of Cuban medical science. Okay, so how do we explain the exceptional position of Cuban medical science? Well, there's a number of factors. First is the post-1959 commitment to universal free public health and education. Healthcare, in the Cuban perspective, since 1959, is a human right and a constitutional right. And it's really important to point out they don't have a dual-track system as we do have in Britain. So we have a national health service, but those with the resources can opt out and get private healthcare. That doesn't exist in Cuba. So you have the same access to the same healthcare for everyone. And the other distinctive feature is there's very little disparity between rural and urban areas. If you look at things like infant mortality and life expectancy, you won't see those stark differences that you get including in many of the most advanced capitalist countries between either ethnic groups, people of different racial backgrounds, or different regions of the country. So, likewise, the same can be said for the education system, which provides the critical mass of medical scientists on which this incredible biotech sector is built and the innovations that they produce. So, this is in the broader context of state control in a planned economy in which no private interests need to be accounted for or can interfere with the priorities of social welfare, and there is no speculation. We also have to recognize the protagonistic role of Fidel Castro, who really expressed the political will since the very outset of the revolution to develop science and technology within the revolution as a means to socio and economic development. So not to line private profits, but to raise the Cuban nation. The advances in biotechnology also build on a long history of infectious disease research and vaccinations. Carlos Finlay is the most well-known character in that, who discovered that the yellow fever came from mosquitoes, and his contribution was even recognized by President Obama when he announced rapprochement, the brief rapprochement between the United States and Cuba. The United States blockade, which was implemented in part in 1960, fully in 1961, has imposed the need for Cuba to produce its own medicines and medical equipment, because medicine and food are included in the prohibitions of the US blockade. And there is also an important integration between universities, research centres, medical science enterprises, and the public health system, which I've been talking about. I'm just going to say a few things about how Cuba is dealing with the pandemic domestically. And this is based on Cuba's history. Cuba is globally recognized for its response to natural disasters and climate change related disasters, an incredible ability for disaster risk management and response, an incredible ability to mobilize national resources and to use what's called in Cuba the organizations of the masses, the grassroots organizations, which are represented in every community in Cuba, to really prioritize protection of human life whenever there's any sort of disaster, whether it's health or natural disaster. So they've been mobilizing that ability, including drawing on the resources they have, the healthcare resources that they have, the fact that they have a family doctor system where doctors and nurses live in the communities that they serve. That has been a really key feature. And also the results of the biotech industry. All of this has been harnessed to respond to COVID-19. So they've been carrying out door-to-door health checks, so checking in every home what underlying conditions people have. They know who's vulnerable. They will know if there's an outbreak in a certain area, there's people who need extra protection. They've been testing, contact tracing, quarantining, and they continue doing these things when many governments, like my own, have given up on contact tracing very early on. They're using public education, campaigns, and daily updates. They have also implemented the measures most governments have implemented of lockdowns, social distancing. People are encouraged to wear face masks when they leave the house. They've closed the border, which was a very difficult decision for an economy so dependent on tourism income. But when a resident enters Cuba, now they are obliged to enter quarantine, but this is supervised quarantine. They're not just told go back to your house and try and stay at home. They are actually in places set up with medical carers there who are constantly testing them. Widespread use of face masks and PPE. They have increased domestic production. They had the capacity for domestic production, which seems to be a capacity that many of the advanced capitalist countries suddenly found out we don't have. Cubans have repaired. What's that?
That's for sure. We sure did.
Yeah. Cubans have repaired their existing ventilator stock, but they've also made efforts to purchase new ventilators and respirators, and unfortunately these are currently being obstructed by the United States. I've just checked an article about a company that Cuba had just contracted and paid to import respirators, and that has been blocked by the US blockade. Patients with COVID-19 are treated in Cuba with 22 medicines. The medicines focus on what they're treated with depends on their condition and the stage of their condition. But their medicines focus on those which strengthen the immune system of vulnerable people, antiviral medicines for those who actually have the virus to help their bodies to fight that, and drugs to prevent patients in a critical state from dying. At the same time, it's recently been announced that all Cubans are going to be given a homeopathic medicine, which is tried and tested and proved in Cuba, called Prevengo V. So every Cuban will get that.
What's it called?
Sorry?
What's it called again?
It's on the slide in blue, Prevengo Via.
Oh, okay.
Yeah.
Yes.
So at the same time, they have two vaccines that stimulate the immune system. So in a general sense, that are being evaluated, and they are currently designing 4 candidates for specific preventative vaccine for COVID-19. That process is underway. So one approach is to say COVID-19, the ability of individuals to combat COVID-19 seems to be very closely related to the strength of their immune system. And therefore, treatments that bolster the natural immune system are going to help. So they're working with those, but at the same time, they are working with a specific vaccine for COVID-19, which require, there are 60 candidates around the world apparently, and this requires intricate knowledge of how the virus functions. And that is my presentation. So thank you for listening.
And here's your book.
And this is a photo of my book, which has literally just come out. My new book. And unfortunately, all of my book launch events have been cancelled. So I thought I'd put it on the slide, and the information on the presentation draws from one of the chapters in the book called The Curious Case of Cuba's Biotech Revolution. And the book is called We Are Cuba, How a Revolutionary People Have Survived in a Post-Soviet World.
Well, what did you say? That what's been canceled? Delivery of the books?
No, all my launch events. So I was going to go go and speak at events.
Right, right.
I can now do that digitally, but it's not quite the same.
Right, right. Well, I'm definitely going to do my best to get this out there. We'll have it on the show, and I'll do my best to get it seen, because this is just fascinating, such important information for people to know, that it isn't the same everywhere. And that we can have other examples of innovation, even in the face of a lot of attempts to squash it, basically, because the effects of the blockade really cannot be overstated. So
and so in my book, I have chapters with similar detail of developments that have taken place in relation to something called the energy revolution and the attempts to shift towards renewable energy. Likewise, an episode in Cuba called the Battle of Ideas, which was about renewing the role of young people in the revolution. It incorporated an education revolution. It was about raising the level of ideological commitment to the revolution in the context of the onslaught by the Bush administration and the attacks on Iraq and Afghanistan, which seemed to testify to the invincibility of US imperialism at that point, but also saw that commitment needed to be accompanied by material improvements in the standard of living. The energy revolution is fascinating. Cuba became the first country in the world to substitute all its light bulbs for energy-saving light bulbs.
wow.
And it did this in 6 months. And yet, again, almost nothing is known about that episode. In the same year that, or the same period where that was accomplished, the World Wildlife Fund stated that Cuba was the only country in the world to have achieved sustainable development, which means living within the carrying capacity of its ecosystem, so not destroying the earth quicker than it could reproduce itself, at the same time as raising the standard of living for its population. And, Cuba is still among the handful of countries that live within the carrying capacity of their ecosystem, and it does better than the other countries are close to it in terms of its human development indicators. So the fact that this country, a small Caribbean island subject to hundreds of years of colonialism and then imperialism and then US blockade, and yet the UN has declared it categorizes as high human development. It has some astonishingly inspirational human development indicators. It has the greatest contribution of medics around the world than any country. Leading in sustainable development. There's clearly so much rich detail going on there, and that's what I was trying to do with my book, really, is to tell a bit of that story.
Right. There's something going on there that maybe we want to know about. So, Helen, thank you so much for joining me this morning, and I'm so happy that this actually went as long as it needed to. It didn't cut off, and also that it didn't get very much static due to the advance of time, which I was also a little concerned about, but none of that happened. So that's great, and thank you so much for being my guest.
Well, thank you for inviting me, and good luck with your show. I hope it goes well. It sounds great. Will you send me a link so I can share and see?
Absolutely.
Lovely. Good. Great.
Have a beautiful day, and thanks for making the world a brighter place.
And thank you for doing the same. Okay. Bye-bye.